Every 3 seconds, someone in the world begins losing a piece of their memory. By the time this video ends, hundreds more families will notice that a parent or grandparent isn't quite the same anymore. But here's the frightening part. What looks like the beginning of dementia may not be dementia at all. It could be hiding inside a pill bottle that's sitting on your kitchen counter right now. I've spent decades caring for older adults, and one of the most heartbreaking moments is watching someone believe they are developing Alzheimer's only to discover that a medication they trusted was quietly affecting their memory, attention, and thinking. Or worse, watching someone ignore the warning signs of true dementia because they assume it's just my medicine. That mistake can cost precious time. If you're watching today, tell me your age in the comments below. And if you take more than 3 medications every day, simply type meds. I read every comment, and your answer may help someone else realize they're not alone. Today, we're going to uncover the critical differences between medication side effects and the earliest signs of dementia. You'll learn why these two conditions are so often confused. You'll discover the warning signs that should never be ignored. And you'll find out which medications are most commonly linked to temporary memory problems without ever stopping a prescription on your own. But stay with me until the end. Because one subtle sign, often dismissed as just getting older, may reveal far more than most people ever imagine. Let's begin. Imagine walking into your kitchen. You open the refrigerator. Then suddenly, you can't remember why you came there. Most of us laugh it off. We all forget things. I'm just getting older. It's probably nothing. Sometimes, that's true. But sometimes, it isn't. In my years treating older adults, I've learned that memory changes are rarely as simple as they appear. Two very different problems can look almost identical on the surface. One may be a temporary reaction to a medication your doctor prescribed for an entirely different condition. The other may be the first quiet footsteps of a disease that slowly changes the brain over time. And that's exactly why so many people become confused. Medication side effects can mimic dementia so closely that even experienced healthcare professionals often need careful testing, detailed medical histories, and time to tell them apart. Here's what surprised me. Many patients arrive convinced they have Alzheimer's because they suddenly feel forgetful, mentally slow, or unable to concentrate. Then we carefully review their medications. Perhaps a sleeping pill was started 2 weeks earlier. Maybe a new bladder medication was added. Sometimes an allergy medicine that seemed completely harmless turns out to affect the brain more than anyone expected. After adjusting the treatment under medical supervision, their thinking gradually becomes clearer. Their confidence returns. Their families breathe a sigh of relief. That changes everything. But the opposite can happen too. Someone notices small memory lapses. They assume their medications are responsible. They wait. They hope the problem will simply disappear. Months pass. The forgetfulness slowly worsens. Bills go unpaid. Appointments are missed. Names become harder to remember. Driving familiar routes suddenly feels confusing. By the time they seek medical help, valuable opportunities for early diagnosis and treatment may already have been lost. That's why understanding the difference matters so much. Not because every memory lapse means dementia, and not because every medication is dangerous, but because recognizing the right pattern can help you and your doctor make better decisions before the problem grows larger. Recent research suggests that certain medications can temporarily affect attention, alertness, and memory, particularly in older adults whose brains become more sensitive to these effects with age. At the same time, researchers have learned that the earliest stages of dementia often begin years before a formal diagnosis. The warning signs are usually subtle, quiet, easy to overlook, and that's the problem. Over the next few minutes, we're going to compare these two conditions side by side. You'll learn which symptoms usually point toward a medication side effect, which warning signs are more typical of early dementia, which questions your doctor is likely to ask, and most importantly, you'll discover what you should never do if memory problems suddenly appear. Because one simple mistake made by thousands of older adults every year can actually make the situation much worse. Let's start with the very first clue. It often appears long before anyone realizes what's happening. Item 1. When did the symptoms begin? The timeline that changes everything. If I could ask only one question to someone worried about memory loss, it would be this. When did it start? It sounds almost too simple, but that single answer often provides one of the biggest clues. Here's why. Medication side effects usually appear after something changes. A new prescription, a higher dose, an additional medication, or even an over-the-counter product that seems completely harmless. Sometimes the change happens within a day. Sometimes it takes a week or two. but the timing often matches. I've seen patients who were thinking clearly 1 month, then suddenly became forgetful after beginning a medication for sleep, allergies, bladder control, or pain. Their family became terrified. Is this Alzheimer's? Is dementia starting? Those are understandable questions, but not always the correct ones. Now compare that with early dementia. The beginning is usually much quieter. There isn't one specific day when everything changes. Instead, family members often look back months or even years and realize the small signs had been there all along. Perhaps dad began repeating the same story at every family dinner. Maybe mom started asking the same question several times without realizing it. Perhaps birthdays became harder to remember. Bills that had always been paid on time suddenly piled up unopened. No dramatic event, just a slow, almost invisible progression. That's an important difference. Think of medication side effects like someone suddenly dimming the lights in a room. You notice it immediately. Early dementia is more like watching the sun slowly set. The light fades so gradually that your eyes adjust without realizing how much has changed. A recent review published in medical literature has emphasized that carefully reviewing the timeline of new cognitive symptoms alongside recent medication changes is one of the first steps clinicians take when evaluating memory concerns. In many cases, identifying a medication-related cause can prevent unnecessary testing and anxiety. I remember a patient I'll call Robert. He was 78 years old. His daughter brought him to the clinic because he had become unusually forgetful over the previous 10 days. He misplaced his glasses several times, forgot conversations, even struggled to balance his checkbook. His family feared the worst. But as we talked, one detail stood out. 10 days earlier, he had started a new medication to help him sleep. His physical examination was reassuring. His memory problems seemed to fluctuate throughout the day. After discussing the situation with his prescribing physician, his treatment plan was adjusted. Over the following weeks, Robert's thinking gradually became clearer. His confidence returned. His family felt enormous relief. The good news is that medication-related memory problems can often improve when the underlying cause is identified and managed appropriately by a healthcare professional. But, and this is a very important but, you should never stop a prescribed medication on your own. Stopping certain medications suddenly can be dangerous. Always discuss concerns with the doctor or healthcare professional who prescribed them. Now here's where the story becomes even more interesting. Because timing alone isn't enough. Some people develop confusion almost overnight. Others slowly lose the ability to form new memories while appearing perfectly alert. That next clue may be even more powerful than the timeline itself. And most people have never heard of it. Item 2. Are you forgetting or simply unable to focus? Here's a question that surprises many families. Is the problem really memory or is it attention? At first, those two things seem identical. Someone forgets a conversation, misplaces the television remote, walks into a room and can't remember why. It all looks like memory loss, but the brain doesn't always work that way. Here's what many people never realize. Before your brain can store a memory, it has to pay attention first. Think of your brain like a camera. If the camera lens is out of focus, the picture will always be blurry. Not because the camera can't save the image, but because it never captured it clearly in the first place. The same thing happens inside the brain. Many medication side effects reduce alertness or concentration. The information never gets recorded properly. Later, it feels as though the memory disappeared. In reality, the brain never had a clear chance to save it. That changes everything. Early dementia is often different. During the earliest stages, many people remain awake, alert, and fully engaged in conversation. They understand what you're saying. They pay attention. But once new information should be stored, something goes wrong. Minutes later, the conversation has vanished. The memory simply isn't there. That's why family members often say something like, "We had a whole conversation at breakfast, and by lunch she didn't remember any of it." That pattern immediately catches a clinician's attention. I remember a woman I'll call Margaret. She was 81. Her husband worried because she seemed increasingly forgetful. He assumed dementia had begun. When we spoke with Margaret, however, something interesting happened. Each time I asked a question, she drifted off halfway through. She struggled to stay focused. She appeared unusually sleepy. Sometimes she answered the wrong question entirely. Her memory test looked poor. But the real problem wasn't memory. It was attention. After reviewing her medications, we found that a recently added prescription was causing excessive daytime drowsiness. Working together with her prescribing physician, her treatment plan was adjusted safely. Several weeks later, Margaret returned. She was more alert. She followed conversations with ease. Her memory scores improved significantly. Her husband smiled before either of them sat down. "I have my wife back," he said. Moments like that remind us why careful evaluation matters, because appearances can be deceiving. Research has shown that medications with strong sedative effects or medications possessing anticholinergic properties can interfere with attention, processing speed, and short-term thinking, particularly in older adults whose brains become more sensitive with age. But there's another clue that's even more revealing. Medication side effects often change from one hour to the next. Some mornings, a person seems almost normal. By afternoon, they're confused. Then, after a good night's sleep, they're noticeably better again. Early dementia usually doesn't behave that way. The changes are often subtle, but they are remarkably consistent. Day after day, week after week, month after month. And that's where our next warning sign becomes incredibly important. Because it isn't just what someone forgets, it's whether the symptoms come and go or quietly continue to grow. That difference may tell us more than almost anything else. Item 3. Do the symptoms come and go, or do they keep getting worse? Now we're going to look at one of the most revealing clues of all. Not what the symptoms are, but how they behave over time. Because the pattern often tells a story that individual symptoms cannot. I've seen two patients walk into my office with almost identical complaints. Both were forgetting names. Both misplaced everyday objects. Both struggled to find the right words. Yet one eventually recovered completely. The other was beginning the early stages of dementia. The difference wasn't immediately obvious. It became clear only after we watched what happened over time. Medication-related cognitive side effects often fluctuate. One morning, a person may seem perfectly sharp. By late afternoon, they're unusually forgetful. The next day, they seem much better again. Their family starts wondering if they're imagining the problem. Yesterday, mom seemed fine, but today she's confused again. Maybe she's just tired. That up and down pattern is an important clue. Many medications affect the brain differently depending on when they're taken, how well the kidneys and liver are clearing them, whether the person is dehydrated, or whether they slept well the night before. Even a mild illness can temporarily make these side effects much more noticeable. So the confusion isn't always constant. It may seem to come in waves. That matters. Early dementia usually tells a different story. The changes are often subtle, but they're persistent. Instead of good days followed by complete recovery, there is a slow decline that unfolds almost unnoticed. Perhaps 6 months ago, someone occasionally forgot an appointment. 3 months later, they began missing several appointments. Now they can't remember making them at all. The progression isn't dramatic. It's steady, almost like watching a tiny crack spread across a windshield. At first, it's barely visible. Then, little by little, it reaches farther than anyone expected. Family members often describe it this way: something just isn't quite right anymore. I can't point to one big change, but every few months I notice another small difference. That gradual progression is something clinicians pay close attention to. I once cared for a retired school teacher named Helen. She was 76 and had always been remarkably organized. One spring, she began forgetting where she placed her reading glasses. Her children weren't overly concerned. Everyone loses their glasses now and then. A few months later, she started missing weekly bridge games because she forgot what day it was. Then she repeated the same stories during family dinners. Not once. Several times in the same evening. When her daughter gently reminded her, Helen looked genuinely surprised. She had no memory of telling the story before. Unlike medication side effects that often improve or fluctuate, Helen's changes quietly continued. Each season brought another small loss, another forgotten conversation, another missed appointment, another familiar task that suddenly felt unfamiliar. Her family sought medical evaluation, and she was eventually diagnosed with early dementia. Because they acted early, they were able to begin treatment, plan for the future, and put safety measures in place while Helen could still participate in every decision. That gave her family precious time they would always be grateful for. The good news is that keeping a simple journal can help reveal these patterns. Write down when symptoms occur. Note any recent medication changes. Record whether confusion appears only after taking certain medicines, late in the day, or during illness. Also note whether the symptoms are gradually becoming more frequent over weeks or months. This information can be incredibly valuable for your healthcare professional. Never underestimate it. Because sometimes the pattern tells the diagnosis long before any scan or memory test does. But the next clue may be the most misunderstood of all. Many people believe memory loss is the first sign of dementia. Surprisingly, For some people, it isn't. And recognizing that difference could change everything. Item 4. It's not just memory. Watch for changes in everyday life. Here's something that surprises many families. Early dementia isn't only about forgetting. In fact, some people notice changes in daily life long before memory becomes an obvious problem. That's because the brain does much more than store memories. It helps us make decisions, plan our day, solve problems, manage money, prepare meals, follow familiar routines. When these abilities begin to fade, everyday life quietly becomes more difficult. And that's where an important difference often appears. A medication side effect may make someone feel groggy or distracted for a few hours. They might forget where they placed their reading glasses. They may need to reread a page in a book because they weren't fully focused. But once the medication effect wears off or the medication is adjusted under medical supervision, they can usually return to the same daily tasks they have performed for years. Early dementia is different. The challenge isn't simply remembering. It's completing familiar activities that once felt automatic. Imagine someone who has balanced the family budget every month for 40 years. Suddenly, the numbers no longer make sense. Checks are written incorrectly. Bills are paid twice. Some are forgotten altogether. Or picture a grandmother who has baked the same apple pie every Thanksgiving since her children were young. One afternoon, she opens the recipe she's used for decades. Halfway through, she stops. She can't remember which ingredient comes next, even though the instructions are right in front of her. That is an unordinary forgetfulness. It's the brain struggling with planning, sequencing, and carrying out familiar tasks. And that's a very different process. I remember a patient named James. He was 74 and had proudly managed every household responsibility since retiring. His wife wasn't concerned about his memory at first. He remembered birthdays. He recognized friends. He could recall stories from years ago with remarkable detail. But little things began changing. He forgot how to use the online banking system he had mastered years earlier. He accidentally paid the electric bill 3 times in 1 month. Then he left the stove on after making breakfast. Not once. Several times. His family assumed stress was affecting him, but the pattern continued to grow. When James underwent a comprehensive evaluation, his memory was only mildly affected. The larger problem involved executive function, the brain's ability to organize, plan, and complete complex tasks. Those changes pointed toward the early stages of dementia rather than a temporary medication reaction. That realization allowed his family to make important adjustments before a serious accident occurred. Research has shown that difficulties managing finances, medications, cooking, transportation, or other complex daily activities are often among the earliest functional changes noticed in people developing dementia. These changes usually appear gradually and become more consistent over time. The good news is that noticing these warning signs early gives families more choices, more time, more opportunities to plan, more chances to maintain independence safely for as long as possible. That's why loved ones often play such an important role. Sometimes the person experiencing the changes doesn't recognize them, but a spouse, an adult child, or even a close friend may quietly notice that familiar routines are no longer as effortless as they once were. Never ignore those observations. They may be the first pieces of a much larger puzzle, but there's another clue that many people completely overlook. It doesn't happen in the kitchen, or while paying bills. It happens during conversation, and once you recognize it, you'll never listen to everyday conversations quite the same way again. Item 5. Listen carefully. The way someone speaks can reveal more than their memory. Have you ever been talking with someone, and suddenly they stop in the middle of a sentence? They know exactly what they want to say, but the words simply won't come. Most of us have experienced that from time to time. As we age, occasionally forgetting a name or searching for the right word is completely normal. It happens to healthy brains. It happens to doctors. It happens to everyone. That alone is not a sign of dementia. But here's where the pattern becomes important. With medication side effects, people often describe their thinking as foggy. It's like my brain is moving through mud. I know the answer, but I can't think clearly. They may speak more slowly because they're sleepy or less alert. Once the medication effect wears off, the conversation becomes much more natural again. Their thoughts return. Their words come back. The fog lifts. Early dementia often sounds different. The person isn't simply slow. They begin losing access to words and ideas that were once effortless. Instead of saying microwave, they might say, that thing that heats the food. Instead of granddaughter, They may pause for several seconds, searching desperately for a word they've used thousands of times. At first, these moments are rare, easy to dismiss. But over months, they become more frequent. Conversations grow shorter. Stories become harder to follow. Sentences may trail off before reaching the point. Family members sometimes notice another change. The same question appears again and again. Not because the person wasn't listening, but because they truly don't remember asking it before. That distinction matters enormously. I've seen husbands quietly answer the same question 10 times in a single afternoon, not with frustration, but with sadness, because each answer disappears almost as soon as it's spoken. That is very different from someone who says, "I'm sorry, I wasn't paying attention. Could you repeat that?" One reflects an attention problem. The other reflects difficulty forming new memories. Those are not the same process. I remember caring for a retired newspaper editor named Linda. She had spent her entire career working with words. Language was her greatest strength. One afternoon, her daughter noticed something unusual. Linda pointed toward the refrigerator and said, "Could you hand me the cold box?" Everyone laughed, even Linda. She brushed it off as getting older. But over the next year, similar moments became increasingly common. Simple words disappeared. Sentences became less organized. Sometimes she abandoned a story halfway through because she couldn't remember where it was going. Her memory tests later confirmed the earliest stages of dementia. Looking back, her family realized the changes in language had appeared before anyone truly appreciated their significance. Research suggests that subtle language changes, especially increasing difficulty, finding familiar words or following complex conversations, can appear early in certain types of dementia. These changes usually develop gradually rather than overnight. Medication side effects, on the other hand, are more likely to produce generalized slowing, drowsiness, or difficulty concentrating than a steady decline in language abilities. The good news is that paying attention to conversation can provide valuable clues. Notice whether someone simply needs information repeated because they were distracted, or whether they genuinely cannot retain what was just said. Watch for increasing pauses. Repeated questions, difficulty naming familiar objects, or conversations that slowly become harder to follow over time. Small details, big meaning. And now we come to one of the most important parts of this entire discussion, because even experienced clinicians don't rely on symptoms alone. There is one final step that can completely change the picture. It's the step that prevents both misdiagnoses and unnecessary fear. We'll talk about that next. Item 6. Never guess. A complete medication review may reveal the real cause. After hearing everything we've discussed so far, you might be wondering, so how do doctors know for sure? The answer may surprise you. There isn't a single blood test that instantly tells us whether memory problems are caused by medication or early dementia. Instead, the process begins with something far more basic: a conversation, a careful review, and one simple question. What exactly are you taking? You'd be amazed how often that question changes everything. I've met patients who confidently told me they took only 3 medications. Then we emptied a small shopping bag they had brought to the appointment. Inside were prescription medicines from 3 different specialists, 2 over-the-counter sleep aids, an allergy tablet, several herbal supplements, pain relievers, cold medicine, a leftover prescription they occasionally used just in case. By the time we finished counting, there were nearly a dozen products that could potentially affect how the brain functioned. That isn't unusual. In fact, many older adults see several healthcare providers, and each medication may be appropriate on its own. But when multiple medicines are combined, the effects can add up in unexpected ways. Doctors call this polypharmacy, the use of multiple medications at the same time. As we age, our bodies process medications differently. The kidneys may remove drugs more slowly. The liver may break them down less efficiently. Body composition changes. Even the protective barrier between the bloodstream and the brain becomes more vulnerable. The result? A dose that caused no problems at age 50 may produce confusion, drowsiness, or poor concentration at age 75. That's why medication reviews become so important. Research has consistently shown that regular medication reviews can help identify drugs that may contribute to falls, confusion, excessive sleepiness, and cognitive impairment in older adults. Sometimes the solution isn't stopping a medication. It's changing the dose, switching to a safer alternative, or eliminating unnecessary duplication, always under medical supervision, never on your own. I remember a gentleman named Charles. He was 80 years old. His daughter feared he was developing dementia because he had become forgetful, unsteady on his feet, and unusually quiet. She was already preparing herself for the possibility that her father would lose his independence. During our visit, we reviewed every medication he used, not just prescriptions, everything. That's when we discovered something unexpected. Charles was taking two different nighttime medications prescribed months apart by different physicians. Neither doctor realized the other medication was still being used. On top of that, he was taking an over-the-counter antihistamine every evening because he believed it helped him sleep. Together, those medications were producing a powerful, sedating effect. After his healthcare team carefully adjusted his treatment plan, the difference was remarkable. Within several weeks, Charles became more alert. His walking improved. He joined family conversations again. His daughter later told me, "I thought I was losing my dad. Instead, we found the problem hiding in his medicine cabinet." Stories like Charles's remind us of something incredibly important. Not every memory problem is permanent. Not every episode of confusion means dementia. Sometimes the brain is simply reacting to medications that were prescribed with good intentions. But here's the other side of the story. Sometimes a careful medication review finds nothing that explains the symptoms. The medicines are appropriate, the doses are correct, nothing changes, and the memory problems continue to progress. When that happens, clinicians begin looking much more closely for conditions like mild cognitive impairment or early dementia. That's why a medication review is never the final answer. It's the beginning of the investigation. One of the most valuable steps you can take before a medical appointment is to bring a complete list of everything you use. Include prescriptions, over-the-counter medications, vitamins, herbal products, sleep aids, eye drops, even occasional medications you only take once in a while. Those details matter more than most people realize, because the smallest bottle in the medicine cabinet may hold the biggest clue. And now we come to the final lesson. It isn't about medications. It isn't about memory tests. It's about what you should do the very moment you notice these warning signs. That decision could make all the difference. The most important decision you can make is to act early. We've covered a lot together today. We've talked about timing, attention, memory, daily activities, language, medication reviews. Each one provides another piece of the puzzle, but none of them should ever lead you to diagnose yourself. That's the most important lesson of all. I've seen families wait because they were afraid of hearing the answer. Others waited because they convinced themselves it was just getting older. Some blamed stress. Others blamed poor sleep. Many blamed medications without ever asking a healthcare professional to review them. Unfortunately, the brain doesn't wait while we wonder. Time matters. Whether the cause is a medication side effect, a vitamin deficiency, a thyroid problem, depression, an infection, mild cognitive impairment, or the earliest stages of dementia, the sooner the cause is identified, the more options are usually available. That is why acting early is so important. Imagine noticing smoke coming from your kitchen. You wouldn't ignore it simply because you weren't sure whether it came from burnt toast or an electrical problem. You would investigate. The same is true for changes in memory or thinking. You don't have to panic, but you shouldn't pretend nothing is happening either. I've had patients who came to see me after noticing only one or two subtle changes. Because they acted quickly, we found treatable causes such as medication interactions, dehydration, vitamin B12 deficiency, poorly controlled diabetes, sleep apnea, or thyroid disease. After treating the underlying problem, many experienced meaningful improvement. Those are some of the most rewarding moments in medicine. But I've also cared for families who delayed seeking help for years. By the time they arrived, everyday tasks had become overwhelming. Driving was no longer safe. Managing medications had become confusing. Financial mistakes had accumulated. Their loved one required far more support than would have been necessary if the condition had been recognized earlier. Those conversations are never easy. The encouraging news is that today's healthcare professionals have more tools than ever before. A careful medical history, medication reviews, blood tests, cognitive screening, brain imaging when appropriate, and, just as importantly, conversations with family members who have quietly observed changes over time. Each of these pieces helps build a clearer picture. No single symptom tells the whole story. Instead, doctors look for patterns, how the symptoms began, how they've changed, whether they fluctuate or steadily progress, whether they interfere with everyday life, whether they improve after addressing possible reversible causes. That complete picture is far more valuable than any one memory lapse. So if you notice changes in yourself or someone you love, don't ignore them. Don't assume they're simply part of getting older. And don't stop medications on your own in hopes of fixing the problem. Instead, schedule an appointment with your healthcare professional. Bring a complete list of every medication and supplement. Write down the symptoms you've noticed. Ask a family member or trusted friend to come with you if possible. Sometimes they see changes that are difficult to recognize in ourselves. That one appointment may provide reassurance. It may uncover a reversible medication side effect. Or it may identify the earliest signs of a condition that deserves prompt attention. Either way, you'll have taken the most important step. You'll be replacing uncertainty with knowledge. And knowledge gives you choices. It gives you time. It gives you hope. Because while we cannot prevent every disease of aging, we can often recognize problems sooner, make wiser decisions, and protect the independence and quality of life that matters so much. Never underestimate the power of acting early. Sometimes, it changes everything.